Welcome to Aging Untold. Finding the right assisted living community for a loved one is one of the most important decisions a family can make. Many communities offer caring staff, active social programs, and added safety that help residents thrive. But sometimes people feel the journey can include misleading promises and hidden cost. Amy, let's begin with the basics. What are the different types of options for assisted living?
So the first thing I want to say is when I start talking to somebody about assisted living, they immediately have in their head nursing home. Right. And there's a clear difference between the two. Mm-hmm. And how you need to look at it is how dependent your person is on hands-on care. Do they need lots and lots of help? Nursing home is like a hospital, 2 beds, 2 overbed tables, cubicle curtain. That's nursing home. Assisted living, there's all types. You can live in a small home, you can live in a medium size, you can have your own apartment. And then there's assisted living that provides care, medical care, and there's communities that provide memory care. And so you look at your person and you say, what's the primary need? Is it memory care? All right. Do they have the environment set up? Is there freedom of wandering? Are there programs 12 hours a day? Or is it just a locked door? Oh, we have a memory care and it's a secure unit, but it really is just a locked door. Right. If it's medical, what's the nursing staff supervision like? Who's the director? Is there a director of nursing? How many doctors come into the community? So you want to be really, really careful that you're looking at what the needs are and then where you're going to move your loved one in.
And then you mentioned them, the smaller, like the homes, the RCFEs or board and cares. It depends on your state what they're called, but they're a little more intimate. They're in residential areas, 6 beds typically, sometimes a little larger, and those are really good for our introverts or just people that like a little calmer, more intimate family feel. They're also typically more affordable. But I tell anyone that's moving in, you know, the tours look great. That's what they're designed for. It's like buying a house and then finding out the foundation's not good. So you've got to look for the red flags that are there. Talk to the residents. Find out about the food. The food's the number one reason your loved one's usually not going to be happy. You want to look around. Does it smell bad?
Yeah.
Does it smell bad? That's a big indicator right there that we're not keeping up on changes and incontinence and we're not keeping up on our housekeeping. You know, okay, a little bit of dust on a table is one thing, but if I'm walking down the hall and the trash cans are overflowing or there's doors open to apartments and there's somebody just sitting in there parked against almost looking at a blank wall in a wheelchair, then where's the care? Look at how the staff's interacting with the residents. And are they smiling? Are they active? Or are they just like almost robots doing a job and just there, and you can tell that they're disgruntled. If the employees aren't happy, your family member is not going to be happy there.
You know, some of them are really, really pretty. Like some of them are just like Catherine. I know you've had a lot of experience with moving people around in some of the communities.
Some of them are too pretty to where it might unnerve grandma, like, oh, I can't possibly live there. But you know, they might relax about that over time. And then on the other hand, sometimes they don't look like much, but that could be where the best care is. That could be where the best social activities are. Mm-hmm. So really look beyond the aesthetics.
Kind of like those restaurants, they look like a hole in the wall, but man, they have the best food.
Oh, absolutely.
That's a great analogy.
Absolutely.
But the other thing too is you have to look at who's giving the medication and how prone are they to make mistakes and how do they handle those mistakes. Right. So I would see the benefit of a smaller unit there because the ratio of staff to patients, you have to look at that. And that's a big deal. And who all do they include in that staff, in that number, like you said?
Who's in that ratio? Yeah. Who's included?
Yeah. And then you also have to look at what about their dietary needs? How do they fix the foods for the appropriate medical conditions? So people who are diabetic need a specific diet. People who have kidney disease, they need a specific diet. Who does that? How do they figure out who oversees that? And who are the physicians or providers coming in to oversee everything?
Right.
I mean, that's nice if you have the psychiatrist coming in, but he's probably not going to be the person that does the internal medicine work.
Right. Yeah, and I think practical tips like Can they walk? Can they walk far? What apartment are they going to have in the community? Is it close to the dining room? Do they have a service where they'll bring food in the morning? Maybe you're not a morning breakfast person. You want your breakfast brought in. How flexible are their services?
Huge.
Do they eat on a routine? Is that 3 meals that are considered? If they have other snacks, are those some hidden costs? What are the hidden costs?
Right.
Should we look for, guys?
Exactly.
Well, I'm glad
These
you
are great
brought that up.
questions.
There's levels of care in a lot of the communities, and they charge per level of care. And you have to ask, how much are those levels?
And what do they include?
And what do they include? And how often do they assess the person? And can you go down a level?
Right.
Maybe you've got better.
Right. Sometimes too, you may have to add care. You may have topped out at their level, and you bring in additional home health care.
So
That's right.
And that happens more frequently than not. So you end up with some of the hidden costs. You get community fees on top of your rent. So what are they and how much are they? Look for that full entire fee schedule. And then what happens if my loved one, maybe they've had a catastrophic stroke, they're still okay in the community care-wise, but who's feeding them? And is that an additional cost? Do you even provide that? Because I have a home care agency that goes into a lot of assisted livings to do one-on-ones. So now you're paying to be in a community with care. You're paying for the highest level of care, but you're having to hire a private agency to come in and do those
Right.
things.
Right.
So you got to be really, really careful about the additional costs because they do mount up